Hello and welcome to week 7 of Advanced Exercise Physiology at Concordia University. Once again, I'm Professor Baines. And a few things for us to note here as we start into our 7th week, finishing out our week 7. First and foremost, difference between heart versus skeletal muscle strength. When you exercise cardiovascularly, the benefits you gain cardiovascularly are not specific primarily to the heart getting stronger. Please be sure you're not making that mention. It has to do with skeletal muscle adaptation. That's the reason why a cyclist will improve their cardiovascular capacity while cycling, but not necessarily while running, while a runner may improve their cardiovascular capacity from running type training, specific to running, but not necessarily to swimming or other sports, as true in any other sport as well. So we're talking about skeletal muscle adaptations as it relates to the specific muscles involved in exercise and the level to which they are taxed or challenged and improve by seeing better performance, better coordination, better force output, better speed, all those things. Better recovery, able to recover between sets, heart rate actually lowering during the set, RP actually decreasing. All those things must be seen to show specific benefit longer term. That said, we'll have ups and downs, but your job is to recognize those factors and make those a part of your regular training now that you know the difference. There's one thing to be doing something you've always done because you don't know any better. Once you have more information available to you, it is your job as a professional, a coach, a teacher, a trainer, to improve upon what you've been doing in the past and add more factors in that have more benefit of actually, or have greater ability to benefit your athletes. That's our job. That said, heart rate variability. Heart rate variability is the timing between beats. It doesn't mean that you have a high heart rate, you have necessarily a high heart rate variability. They are not necessarily the same. It's the time between beats. Whereas someone who has a consistent heart rate variability, a low heart rate variability, it'll be bum bum, bum bum, bum bum, bum bum. Very consistent. That's a low heart rate variability. Whereas a high heart rate variability means bum bum, bum, bum bum, bum bum, bum bum, jumping all over the place. Okay? A highly trained athlete who is well rested, well conditioned, at rest, will have significant variability. Timing between beats will be off because their body's cellular responses are very, very quick to respond and return to normal. But during steady state activity, moderately to higher intensity activity, their heart variability will lower, it will not increase substantially. It'll lower from their resting heart rate. Okay, if they're well conditioned and well rested, and the conditioning or the intensity of the session is not too high. That said, we wouldn't be able to monitor that without a very nice piece of equipment like a heart rate monitor that measures heart rate variability. Polar does that. Polar has an FT60, which I recommended in a previous weekly video, that I highly recommend you possibly get for some of your athletes, or recommend they get themselves to be able to regulate what's going on. Just something to think about, right? Adding more time and more money is always difficult, but at least try to find some way of monitoring that. You can't monitor heart rate variability by taking heart rate. The unfit person at rest will have a actually low heart rate variability, very consistent yet higher heart rate at rest than the fit person. Okay, be very, very consistent heart rate, be actually a low heart rate variability. But as soon as they go into significant activity, their heart rate variability substantially increases, which is exactly the opposite of the fit person. Be careful about mentioning just what the textbook says, in a very general sense, that heart rate variability will increase during activity to an extent, but not necessarily so with a really fit person. It's actually going to decrease at first and actually become more normalized. It's not going to consistently increase. Okay, that's the difference in heart rate variability. So the well-trained person, low resting heart rate with high heart rate variability at rest, and then it's hard to get their heart rate up because they're well-conditioned, well-rested, and yet their variability is going to decrease as they go in higher intensities. At a certain point, of course, it's going to become very highly variable because they're going to reach a point, whatever that might be, where it gets to be too intense. Heart rate pre and post set rationale. Not just taking the heart rate from a general sense, but every time you finish the set. Strength set, interval set, cardiovascular train set, a drill in basketball, it doesn't matter what it is. You need to make a regular habit of having your athletes quickly check their pulse, whether it's the radial artery at the wrist or the carotid artery at the neck. One of the two, at least, if not have heart rate monitors on them. Take it for 6 seconds, add a 0. That's a regular recognition of which heart rate right now. It's 120, it's 110, it's 130. If it's going up, you can bet performance is probably going down. And if you're making something as simple as you can do this interval in this amount of time, this distance, you're going to know if they're improving or not. There's more variables in a lot of performance. That's understood. but heart rate's adding one more variable to understand what's going on. And the higher it's going, the more they're having difficulty with the performance. If they're having difficulty with the performance, they might be getting worse. If they're getting worse, we don't keep pushing. Those are things you need to be thinking about, you're making note of in your post, understanding how to take care of that, which of course means to increase the rest period, make it longer, be more specific to endurance-wise, 30 to 45 seconds or so for rest between sets. It may have to be 60, 90 seconds. If you can't recover in 90 seconds or less, they're getting down at least 120, maybe even 130 beats, at least following some significant set of higher exertion, they're probably not ready to continue. You either need to lower the intensity substantially or call the workout, call the session right now. It's too much. That's hard to do, understood, but it's also the ideal way to see your athletes improve. Don't use websites as your primary info sources. It's okay if you have them, you're citing them, that's fine. But a primary source where you're getting most information from needs to be from research journals or textbook. Preferably the research journal, cite the research journal, not just the textbook, right? But when you cite a website, where are they getting their information from? Just because a website's up, and I know many of you have mentioned Lance Armstrong, the Armstrong Foundation site. It's not bad, but there's some information there that they're repeating what they've seen in articles, other places, and kind of summarizing and not giving it sufficient time and data, where they're not doing a real good job at times of understanding the information or relaying it to other people. So please be cautious about using websites. I encourage you not to do it at all, honestly. It's not wrong. I'm not going to knock you for it, but it's better off. You're better off actually citing research journals for understanding or getting the information you need for your posts, let alone your paper, which you already did. Be clear about your work-rest ratios from here on forward in every single post you ever note. Say our goal for one is to be 3 to 5 minutes long, 10 to 15 minutes long. The rest periods be little to nothing, 10 to 15 seconds, 30 seconds, 60 seconds. Have a rationale as to why. Don't just say it's because that's what we do. You need to now apply it from what you've learned so far. You probably have to do a little bit of research, probably have to look it up in the textbook, get a better idea. I will not knock you down unless you're blatantly wrong and say it's a power set and the work period's 60 seconds. That's not a power set. And the rest period's 20 seconds. That doesn't make any sense. But as long as you have a general idea and you're using research to get some information there, I'm not going to knock you for it. I will give you some clarity, but I won't knock you in points. Okay. GTO and muscle spindle, that's commonly misunderstood for a lot of people. The muscle spindle's job is to cause the muscle to contract, to protect it from actually lengthening too fast or having too significant of a lengthening as a whole. If you throw a ball, you'll feel that twinge. That's the muscle spindle trying to contract, that stretch reflex, the myostatic reflex, trying to protect the muscle. Okay, the GTO tries to get the muscle to actually not contract but relax. The Golgi tendon organ, the muscle-tendon junction, its job is to actually regulate tension. Tension's too high, it will try to get the muscle to relax. However, when you're stretching, if you're straining, you're in pain, if it hurts, if you have any sort of, you're foam rolling, you're doing static stretching, you're doing dynamic motions, it doesn't matter. If the goal is increased flexibility, increased mobility, you can't be having pain of any kind. It can't hurt. It can't be overly difficult if the goal is to increase mobility or flexibility. It should be moderate, such that you don't really feel a contraction. You feel a light little pull. It's not even worth noting. It's not painful at all. It's not like you're trying to tell yourself, no, it doesn't hurt. No, it really doesn't hurt. If it does, you're not going to gain the benefit of the GTO overriding the muscle spindle. You're not going to maximize flexibility or mobility. And as far as muscle fiber types, start making mention of those. Type 1 for endurance type activities, type 2A for more moderate glycolytic type activities, moderate strength capabilities, moderate fatigability, and the type 2X for the power activities, short duration work periods but highly intense, high force production capabilities but requiring significant rest. Start make mention of those things in your posts every week and you're going to get the benefit of the points and we're going to get the benefit of helping each other understand how to apply this information in our regular coaching. And of course, broader perspective on training and between. You need to make sure you're making more clear, as I already mentioned, about adding more to each post. This is how I'm going to apply it. This is how it makes sense. When we talk about lowering blood pH, what's that mean? Acidosis increases. Okay, that's reducing our ability for the muscles to contract. It's reducing our ability to replenish ATP. It's reducing our ability to recover. So consequently, what we need to do is to add more rest, lower the intensity. Sure, add more water and food, which you've all made mention of, but we're talking about coaches right now. What do you do in the moment when it's happening? Right? And those things we'd be monitoring heart rate, monitoring RPE, as well as the performance to understand what's going on and how to adapt the rest, how to adapt the work period. But you got to be as specific as possible, not whether you're right, be specific about what you would do, okay? Make that a regular part of your posts. And then ongoing in this week now, we're talking about now concept of overload. Don't confuse overload and overstress. Overload is overloading an aspect, an organ or a tissue, increasing force production capability or work capacity. From a very general sense, that's what you're trying to do. You increase endurance or increase strength. Power is an aspect of explosive strength. There's starting strength, there's acceleration strength, there's max strength, there's all sorts of aspects of strength. But generally speaking, we're talking about improving some parameter of strength or endurance, which is technically all strength, technically. That said, overstressing the system, the central nervous system, through fatigue by getting someone to be worse, you're moving slower, you're moving with less coordination, you're less able to handle the same short amount of rest, but you're having someone work. Don't, again, confuse psychological versus physiological benefit from an exercise. Be clear what the goal is. Make sure that the athletes understand that, let alone that you understand it going into it. Okay? Too often, too many times, you see a coach, or I should say a team, or a single athlete, or a group of athletes who are really good at the beginning of the season, and they falter as the season goes on. That's a coaching problem. That's a specific coaching problem. Pushing too hard too soon, so athletes may start out better than other athletes and other teams, but that particular coach or that particular team is not recognizing the need to progressively, gradually improve stress, gradually overload. Not overload the system, just aspects of the system through frequency, how often you do something, intensity, heart rate-wise, RPE-wise, loading-wise, what muscle fibers are involved, type of exercise, what specific form of exercise is that going to take, running, cycling, lifting weights, throwing a medicine ball, what, time under tension, is it a short set, long set, whatever it might be, and recovery, of course, how much time between sets to recover. All those parameters when we talk overload. And then specificity. Understand that specificity means the exercise must meet the goal in terms of tempo, speed of motion, in terms of what muscles specifically are involved, the coordination of the action specifically involved, what muscle fiber types are involved. There are numerous aspects to specificity. You can get stronger, but it may or may not affect your golf swing because you're not including the specific coordinated action of all the muscles involved in the golf swing. Don't get me wrong. You practice a golf swing or any skill, and you add strength on top of that skill, you're going to see some transference to functionality and improvement in a particular sport. Don't ever make the mistake of saying doing that knee extension, it says leg extension on the machine, is never going to improve your ability to squat or never improve your ability to run. That's just not true. Now, there are better things to do. You better be spending more time running and squatting if that's your goal, but absolutely adding strength on top of skill is going to help immensely with specific functionality, but you must first have skill. Okay? And then in terms of reversibility and detraining, as little as 2 weeks off from strength training or cardiovascular training can have possibly a significant reduction, particularly in cardiovascular training. Stroke volume actually decreases substantially in the first 12 days or so. And basically, you can improve dramatically VO2 max and improve dramatically cardiovascular training in 4 months, like 25 to 50% in some athletes. So as little as 2 or 3% really highly trained, already very fit athletes. But also in a few years, 2-3 years, you can dramatically more than almost double. Okay, 50%, 60% plus in some cases. So you can have substantial benefits by training regularly, but you'll lose it starting in 2 weeks, substantially in 4 to 6 weeks, and within 3 or 4 months, you got to consider someone to be a beginner again, like they're starting over. You can't assume you'll take up where you left off when you spent 3 or 4 months away from activity of any kind, let alone connective tissue response, which requires more compressive forces, specifically as it relates to more strength type training, low velocity type training for maximizing strength and connective tissue and bone density. Okay, VO2 max testing, aerobic capacity is not the end all be all for everything, but you should absolutely, if your clients or your athletes, I should say, are running, jumping, doing anything like that, you got to be clear about what that means percentage-wise of VO2 max as it relates to heart rate, because those factors are important. And it's not to say that just because someone only exerts themselves for 10 seconds, it doesn't matter. It sure does. It's not the same way it would respond. It would be important with an endurance athlete, but absolutely is important. You need to do some sort of maximal testing or recognition of submaximal testing with your athletes if at all possible to do so. There are numerous ones you need to familiarize yourself with for purposes of your post, let alone for the exam and for your own understanding in chapter 15 for possible tests you might use for anaerobic power, for VO2 max, anaerobic threshold with your athletes. That said, be careful about post-regression. A lot of you are doing a very good job with your post, but some of you are starting to fall off a little bit. Don't get discouraged because you don't get full points. If your post is a little bit late, if you forget to actually cite it properly, you'll lose some points. You can always get better. There's plenty of time. Email me. We'll go through your post if you want. That's your job. It's also mine. Test 2 next week. Get prepared. Be reading the chapters at least once, if not twice. Look over the sample posts. Watch those weekly videos, including this one, to actually help you all with your test and your posts. That said, call or email if you have questions. Look forward to working with you further here in the final few weeks. I'm excited, really am. I want to see better and better work product from all of you, the kind of product I know you're all capable of. I know it's always tough. Keep it up. Thanks.